Bismillahirrahmanirrahim. Today I am discussing the cardiac cycle, lecture 2. Duration of the cardiac cycle. In a normal person, a heartbeat is 72 beats per minute. So, the duration of one cardiac cycle can be calculated as 1 minute divided by 72 beats per minute. So, it will be equal to 0.0139 minute per beat. It's 72 beats per minute. Duration of each cardiac cycle will be 0.8 second. Duration of different stages of cardiac cycle is given below. Atrial systole continue for about 0.1 second. Ventricular systole continue for about 0.3 second. Atrial diastole continue for about 0.7 second, and ventricular diastole continue for about 0.5 second. What are the different phases of cardiac cycle? Atrial diastole, the first phase; atrial systole, second phase; diastole, systole, some people also call it diastole and systole. Isovolumic contraction, ventricular ejection, isovolumic relaxation, and ventricular filling. At first look, this graph, which is called the Wiggers diagram, create in the mind of students tons of queries, but this is a very comprehensive graph and provide all the detail regarding the cardiac cycle. Some of the most brilliant professors describe the graph in detail, but beyond the capacity of the students' level, due to which the students lost interest to understand it. Second reason of interest loss is that graph look very congested. Otherwise, it is very comprehensive, detailed, and easily understandable graph. So let's discuss it in a very simple and easy way. One keep in mind that all the curves of the diagram in upward direction show increase intracardiac chamber tension due to contraction. That is, when the chamber contracts, the tension in the chamber increases. The volume in chamber decreases, and depolarization of the cardiac muscle or oblique propagation of the action potential, and each curve in the graph in downward direction shows relaxation of the chamber, decrease in the volume, and repolarization of the muscle. If these points are clear, then the rest of the graph is easy to understand. Let's see that there are, in the uppermost column, there are 3 upward curves in this diagram. The blue one is the pressure of the ventricle, the yellow one is pressure in the atria, the red one is pressure in the aorta. These are the 3 upward stroke curves in the diagram, downward curve in the diagram, and this show depolarization of the ventricle or decrease in the volume of the ventricle. So let's discuss them one by one. The other things here are the ECG graph and the first and second, third heart sound which are produced during the cardiac cycle. So let's discuss them in detail. Wiggers diagram is used to demonstrate the varying pressure in the atrium, ventricle, and arteries aorta during one cardiac cycle. This whole diagram shows the changes which occur or the events which occur during one cardiac cycle. Atrial systole. In atrial systole, atrial pressure increases as the atria contract. Pressure changes in the atria. When the atria contract, the pressure in the atria increase. Here, ventricular pressure increase slightly and in proportion to the atria as blood from the mitral valve open and the blood enters from the atria to the ventricle. At that time there is a slight rise in the ventricular pressure and also rise in the ventricular volume. Slight rise in the ventricular. Here you can see there is a slight rise in the ventricular pressure and rise in the ventricular volume from here to here. Ventricular pressure rises to a pressure greater than the atrial pressure, causing the atrioventricular wall to shut. This produces the first heart sound, which is called S1 and R also loop. It is low pitch sound and long in the duration. From here, when the pressure in the ventricle rises, so when this pressure rises, it causes closure of the mitral valve, and this produces a first heart sound, which is called the loop. Ventricular systole, isovolumic contraction. Ventricular pressure increases as the ventricle contracts. Here you can see there, when the ventricle contracts, the pressure in the ventricle increases. Both the mitral and aortic valve are shut so that the volume of ventricle stays the same while the ventricle contracts. Therefore, this stage is called an isovolumic contraction. Here you can see the mitral valve is closed and the aortic valve is closed, but the ventricle is contracting. So the blood neither can flow from the atria to the ventricle or backflow or from the aorta. So the volume remains the same, but there is change in the pressure. So this is called isovolumic contraction. Ventricular pressure increases to a point where it becomes equal to the atrial pressure, causing the aortic valve to open. When the pressure further increases due to contraction of the ventricle, this aortical valve becomes open. Ventricular systole ejection phase. Ventricular pressure continues to rise as the ventricle continues to until it reaches a peak. There is a contraction remain, the valve is open and the contraction in the ventricle still in progress until it reaches the peak. At 80-85 the aortic valve open, and at 20 it reaches to its peak. During this phase, blood is ejected from the heart, hence why it is called the ejection phase. When the valve opens, the ventricle is contracting, the blood is rushed into the aorta. So this is called ejection phase. Atrial pressure increases as blood enters the aorta from the ventricle, and the aorta contracts to pump blood around the body. When the blood enters from the ventricle into the aorta, the atrial pressures increase, and then the aorta, here you can see the aortic pressure is also increasing, and this contraction in the aorta occurs, and this causes increased pressure in the systemic circulation or in the arteries. Ventricular and arterial pressure decrease after reach a peak as blood is leaving them. Here, when the blood leaves the atria, so the ventricular and the aortic pressure decreases, and there is fall in the aortic ventricular pressure. Ventricular pressure falls lower than the atrial pressure, at which point the aortic valve will close. This produces the sound, the second heart sound, which is called S2 and pronounced as do. This is a high pitched sound and of short duration. You can see the ventricular pressure decrease more than the aortic pressure, and this causes the backflow of the blood, which close the aortic valve, and this produce the second heart sound called the do. Diastole, both aortic and mitral valve are shut, so the volume of the ventricle is constant while whilst they relax. Therefore, this stage is called an isometric relaxation. Here you can see that after peak, both the atria and the ventricle, the aorta and the ventricle become relaxing and the pressure is decreasing, but the ventricle relax more than the aorta. There is no flow of blood from the aorta into the ventricle or from the atria to the ventricle. So this is called isovolumic relaxation. In this stage, all the four valves of the heart are closed and the heart is relaxing. So this is called isovolumic relaxation. When the ventricle pressure falls below the atrial pressure, the mitral valve will open. Here you can see this is the isovolumic relaxation, and there is no change in the volume of the ventricle, because the ventricle has pumped its blood and it has come to its lowest level, and then when it relaxes, there is no flow of blood from the aorta to the ventricle. So during this relaxation, the volume of the ventricle remain constant or same. So this is called isovolumic relaxation. Atrial and ventricular pressure initially drop slightly. When atria and the ventricle, both the pressure in both chambers initially drops slightly, but as the blood enters the atria, pressure starts diastolic filling. So the pressure again rises, and due to this rise, again a second phase of the cycle started. The blood is then again pumped into the general circulation. Here you can see that the ventricle is relaxing, the volume is increasing. When the volume reaches its peak, the contraction again starts, and the next cycle is then started. Atria contract, the P wave appears on the ECG graph. When the ventricle contract, the Q or S complex occur on the ECG graph, and when the ventricle relax or repolarize, the T wave appear on the ECG graph. So this Q. Please subscribe the channel, press the bell icon for incoming notification, and leave your valuable comments for improvement of the channel.